Hi, good morning, everyone. Good afternoon and good evening. I know that we have people from all over the globe. I'm very happy to welcome you to the Stanford University's second annual Spinal Muscular Atrophy Symposium. We do have a very extended agenda to go over the best practices of SMA in this evolving treatment era, particularly paying attention to the new advantages and challenges of this multidisciplinary care. So without further ado, I would like to pass the virtual mic this year to Dr. John Day.
Thanks, Carl. It's great. I welcome you as well. It's great to have you here. We're excited to be doing this for a second year, obviously in a new environment. And I think COVID is forcing us to learn how to do things in a new and in ways improved way. The whole point of this is to try to bring the science and medicine together with rehabilitation and technology so that we can optimize the lives of people living with SMA. So that's the real focus of this. We're certainly interested in talking about the science, but we're not going to emphasize that as much as occurs in other settings, focusing more on how we can apply that to people's lives. So this is the situation we're in. Obviously, doing this virtually allows us to connect around the globe, but that is good in ways, certainly reduces travel costs, but it increases some complexity of how we do this. So this is where we are. This is 8:30 today, and it's approaching the shortest day in the Northern Hemisphere, the longest day in the Southern Hemisphere. And you can see where the sun is shining and where it isn't. So we're connecting across many, many time zones today, and consequently are trying to take that into consideration. That led us to the idea of not just having one enormously long symposium. Not only do you get Zoom fatigue, but I think that complicates the issue across time zones to have the meeting go on very long. So that's why we came up with the idea of having this basically short 3+ hour meeting and then having it on subsequent days that hopefully allows you to have some part of your day when you can still get some work done and be able to join us and have some attention left and not get too mummified, too numb by the Zoom meetings that can go on forever. So that's the concept. We did do this in person last year and had a good representation from people around the North America, but beyond, as you can see, that traveled to California for that meeting. And then where are people from this meeting? There you can see some of the participants. I know of others who are here that didn't make it onto this map. So we do have a participant in Argentina. I know we have several others. So if you don't see your dot, I apologize. But I think you get the idea of the representation. And if you imagine it being in the middle of the night in Kazakhstan and Mumbai, as well as north of Brisbane in Australia, I think you can understand the complexities of this kind of a meeting. So welcome, thank you for being here. We've focused on trying to make it wide, but we still have quite a few people across North America involved as well this year, and we're focusing a lot still on our California mission to try to improve care for SMA community members across California and neighboring states. So this is set up as a CME course so that we're following all the rules and regulations of that. And so if you need continuing medical education credit, contact us. You will get a survey at the end, and hopefully you can give us some feedback, but also get credit for having participated. So we do want to thank our sponsors. We had several sponsors, and thank particularly Biogen, Ionis Pharmaceuticals. We've had the pleasure of working with for many years now, and Scholar Rock, one of the companies that we've been working with more recently, all in the SMA space. So it's great to have them partnering with us on this course. So thank you all very much. You've met Dr. Tessie Rocha and myself, so we are the titular course directors, but I really give credit to Sally Dunaway-Young, who has really been the driving force for this, and you'll obviously interact with Sally quite a bit going forward over the next few days. And Mary Sisney, whom many of you have also interacted with. It's fine to be theoretical. Mary makes sure that we can actually do what we're saying we're doing. So in that regard, what we're trying to do is to have plenary sessions that are dealing with some common issues across the SMA phenotype, ages, and disease severity. And then we'll have breakout sessions where it's more specific to different groups of providers. So physical therapists will have their own breakout session, occupational therapists, speech and language pathologists, and then physicians and nursing. You're not forced to stay in your group. If you want to move back and forth, you should be able to do that. And we'll show you a little bit more how to do that. And then we'll have what we're calling a social hour. We're trying to come up with some way that we can network even though we're virtual. So that's today's talk, where we're going to go over multidisciplinary care and some updates on the SMA treatments. And then each day we're going to have a presentation of one phenotype. Today's will be on non-sitters, and the breakout sessions will focus on that. Tomorrow we're going to focus on sitters, and the breakout sessions will focus on that. The plenary session tomorrow will really be focusing on ethical issues that are really coming to the fore, and I think are teaching us a lot about medical care in general through the lens of SMA. And then on Saturday, again, the breakout sessions will focus on those SMA community members who are still walking. And then we'll focus on newborn screening and social services and some transitional issues that are really of paramount importance to this community. So that's the overall schedule. The point of this is to learn about the science, learn how we can apply standards of care actually in clinical practice, trying to come up with ways of determining the appropriate type of medical and rehabilitative interventions for the different phenotypes, and then to deal with the ethical deliberations that are critically important as we move this all forward. So that's what we're trying to accomplish. We have a tremendous group of faculty members, from across the world participating, and it's going to be educational for all of us to hear from this group. And I thank everyone for working with us on this session. You might be, this might be new to you. We're using this app called Whova. You can download it on your phone. You might find that useful to have in addition to watching this on a laptop. Obviously, you can get here through the website as well, so that you can get to Whova either way. What it does, it works on the Zoom platform, but then helps us organize the conference in what we hope is a little bit easier. We're still learning this. So give us some feedback about what works and what doesn't, so that we can continue to advance this going forward. Just to show you a few points on this, it's going to be better almost certainly to join via Zoom rather than via Whova. This goes through a different path, and I think you might even notice that option has been eliminated. We're going to try to force you to use Zoom directly because that should work a little bit better. But the Whova framework here will still be there, and you can use that, as I'll point out here in a couple of slides. One is to ask questions. So in these plenary sessions, to ask questions, you'll need to type them into the Q&A tab here. Should be straightforward. If you have any kind of technical issues, Mary and her team will be available so that you can connect through the chat. So the chat is for technical issues. For questions to the speakers, please use the Q&A tab. we will not be having any of the speaker-related Q&As through anything on Zoom. So I know this gets a little bit complex. We have two ways you can give us evaluations, and I strongly encourage them. We really want to hear about this. So at the end of each session, you can click on rate the session. That'll give you a tab over here that you can rate it, but also give us some feedback. What do you wish we had done? What do you wish we'd included? What do you think was unnecessary? Anything, give us some feedback. We'd appreciate it so we can continue to advance in meeting the needs of the community. And speaking of the community, there is this community tab. This is the networking tab, and Tina and Mary will be giving kind of an overview of this at the end of the day today in what's called the social hour. There are ways that you can get together one-on-one or in small groups. So if you're the only social worker that you ever know has cared for SMA patients and you want to try to meet up with other social workers, you can do that by setting up a virtual meeting and calling out to other social workers that happen to be on this meeting, and they can join you. So we'll try to help with that, or there are different boards that you can contribute thoughts and questions to. So that we'll review a little bit more later on. And then there are polls. Many of you, I noticed, have already found the polls, and you can answer those at any time. So that please do so, and you'll see the polls, and you can go on there and fill them in, and we'll see kind of what the overview of the responses is as we go forward. So here are the polls for this session. Before I pass it on, I just would like to know where you're from. I mean, where are you watching this around the world? I think a lot of these things are going to be helpful to the speakers so that they kind of are pitching their talks as well as possible for you. And to that end, we'd like to know what your connection is to spinal muscular atrophy. I had very much wanted that you could answer more than one of these, but unfortunately, you have to select only one answer. So pick the one that you think is most important and put that down. Obviously, you could be both a clinician and affected by SMA, but that unfortunately you can't select. So please give us that feedback. And then also, if you are a clinician, put down what your area of interest or specialty is. And again, I gave Mary a list of like 26 different possibilities here, so we couldn't get everybody on here. This is as high as we could go. So I apologize if I left your area out. So that's it in terms of what I wanted to share. Let's take a quick look at the polls. So let's see if we've got 100 or so responses. So in terms of professions, I think everybody can look at that. It's mostly physical therapists, 53%, with 13% occupational therapists, and then some dietitians, genetic counselors, pulmonologists, neurologists, so a good cross-section. So thank you for doing that. And in terms of your connection to SMA, certainly the majority, 75%, are providers of one sort or another. We do have two who are identifying themselves as family members. Again, unfortunately, you couldn't choose more than one answer to this. And then we have a smattering of investigators, administrators, and members of the pharma community, and some new people to the group that have not previously been connected to SMA. So welcome. Then lastly, where are they connecting from? We have 50% from California, another third from the US outside of California, and then throughout Europe and Asia, as well as elsewhere in North America. Notice we had several people register from various sites in East and Western Canada.